The upper arm, elbow, and forearm conditions, Chapter 15. The elbow is a relatively simple hinge joint which only allows for flexion and extension. The elbow joint occurs at the junction of the humerus or upper arm bone and the ulna, which is the larger of the two forearm bones, and the radius. The elbow allows for flexion and extension of the forearm relative to the upper arm, as well as rotation of the forearm and wrist. When the elbow is fully extended, the elbow locks. The humeral ulnar joint is formed by the articulation of the trochlear notch of the ulna and the trochlea of the humerus. It is a simple hinge joint and allows for the movements of flexion and extension. The humeral radial joint is formed by the articulation of the head of the radius and the capitulum of the humerus. It is a ball and socket joint. The proximal radial ulnar joint is formed by the articulation of the head of the radius and the radial notch on the ulna. In any position of flexion or extension, the radius can be rotated in. The movement includes pronation and supination. Due to the movement at the proximal radial ulnar joint, the radial head rotates on the radial notch of the ulna and allows for the movement of pronation and supination. Supination of the forearm occurs when the palm faces upward. The way that I remember supination is you should be able to cup your hands and carry a bowl of soup if you are supinating. When the forearms are supinated, the radius and the ulna are parallel to each other. Pronation occurs when the palms are facing downward. When the forearm is pronated, the radius rolls medially over the ulna. The elbow, unlike other joints, has ligaments on both sides. These are triangular bands which blend with the joint capsule. They are positioned so that they always lie across the transverse joint axis and are therefore always relatively tense and impose strict limitations on abduction, adduction, and axial rotation of the elbow. The ulnar collateral ligament has its apex on the medial epicondyle. Its anterior band stretches from the anterior side of the medial epicondyle to the medial edge of the coronoid process, while the posterior band stretches from the posterior side of the medial epicondyle to the medial side of the olecranon process. These two bands are separated by a thinner intermediary part, and their distal attachments are united by a transverse band below which the synovial membrane protrudes during joint movements. The anterior band is closely associated with the tendon of the superficial flexor muscles of the forearm, even being the origin of the flexor digitorum superficialis. The ulnar nerve crosses the intermediate part as it enters the forearm. The radial collateral ligament is attached to the lateral epicondyle below the common extensor tendon. Less distinct than the ulnar collateral ligament, this ligament binds with the annular ligament of the radius, and its margins are attached near the radial notch of the ulna. When the arm is extended, with the palm facing forward or up, the bones of the arm or humerus and forearm are not perfectly aligned. The deviation from a straight line occurs in the direction of the thumb and is referred to as the carrying angle. The carrying angle permits the arm to be swung without contacting the hips. Women on average have smaller shoulders and wider hips than men, which may necessitate a more acute carrying angle, or less angle than in males when measured from the outside. There is, however, extensive overlap in the carrying angle between the individual men and women, and a gender base has not been consistently observed in scientific studies. This could, however, be due to the small sample size in earlier studies. A more recent study based on a sample of 333 individuals from both genders concluded that carrying angle is a suitable secondary sexual characteristic and indicates sexual maturity. The angle is greater in the dominant limb than in the non-dominant limb of both genders, suggesting that the natural forces acting on the elbow modify the carrying angle. Elbow conditions to be discussed include contusions, Olecranon Bursitis, sprains, dislocation, and both medial and lateral epicondylitis. An elbow contusion is also known as a bruised elbow. It is a condition in which a person has injured the tissues overlaying the elbow, resulting in a bruise and pain over the elbow. The cause of this is commonly a fall or a direct force to the elbow, such as which happens in a bike accident or impact from a hard ball while playing sports such as hockey. Symptoms of elbow contusions or bruised elbow include instant pain on the direct force or impact to the elbow, appearance of a bruise or discoloration of the skin surrounding the elbow, tenderness to touch, swelling may be present, limited or painful movement of the elbow. Symptoms indicating a more serious condition are extreme pain upon elbow movement, which could potentially indicate a fracture. Treatment options for elbow contusions or bruised elbow include resting the arm. The arm should be kept elevated. Compression bandage may be used to decrease the swelling and bleeding. Ice therapy also helps reduce swelling and bleeding. NSAIDs, and a sling can be worn for comfort and to limit the movement to promote healing. If the elbow is extremely painful, then a fracture may be indicated and the patient should seek medical attention right away. Olecranon bursitis is a condition characterized by pain, redness, and swelling around the olecranon process. This is caused by inflammation of the elbow's bursa. This bursa is located just over the posterior aspect of the proximal end of the ulna. In common with other bursa, it is impalpable and contains a very small amount of fluid in its normal state, and fulfills the function of facilitating a joint's movement by enabling anatomical structures to glide more easily over each other. Symptoms include swelling in the elbow, which can sometimes be large enough to restrict motion. There is a pain originating in the elbow joint from mild to severe, which can spread to the rest of the arm. If the bursa is infected, there will also be prominent redness and the skin will feel very warm. Another symptom would include a spontaneous opening or drainage of pus. Conservative management of minor cases involves icing, a firm compression bandage, and avoidance of aggravating activity. This can also be augmented by oral or topical anti-inflammatory medications such as NSAIDs. Elbow padding can also be used for symptomatic relief. Treatment for more severe cases may include the aspiration of the excessive bursa fluid with a syringe or draining the bursa, or injecting the bursa with a type of medication which is aimed at relieving the inflammation and preventing further fluid accumulation. A sprained elbow is a type of injury affecting at least one of the ligaments within the elbow. Each ligament is a strong band made up of tissue responsible for connecting the bones together and forming its joints. If a ligament becomes injured, it may be partially or completely torn or stretched. Any sprain affects the ligaments immediately around the joint, meaning that those experiencing an elbow sprain have torn or pulled at least one or more ligament within the elbow joint. A sprained elbow can happen at any time the arm is twisted or bent into an unnatural position. It may also occur when the ligaments become overloaded during movements, even when those movements are regular in nature and have occurred before without injury. Other causes of sprains can include twisting of the forearm in a forced manner, falling onto an arm which is outstretched, receiving a blow to the arm. Common symptoms accompanying an elbow sprain include pain when the elbow moves, pain, swelling, and tenderness around the elbow, warmth, bruising, or redness around the elbow, and possibly limited mobility of the elbow. Any time that you hear a pop sound at the time of injury, inform your athletic trainer, physical therapist, or doctor, as this may indicate a torn ligament. As long as the person receives proper treatment and care, most people completely recover from a sprained elbow within 3 to 6 weeks. The management of an elbow sprain depends on the severity. We price if it is grade 1, and we refer if it's a grade 2 or 3. Tommy John surgery is more properly known as ulnar collateral reconstruction, or UCL surgery. It is a surgical operation in which the ligament on the medial elbow is replaced with a tendon from elsewhere in the body, often from the forearm, hamstring, or foot of the patient. Overhand throwing places extremely high stresses on the elbow. In baseball pitchers and other throwing athletes, these high stresses are repeated many times and can lead to serious overuse injury. Unlike acute injury that results from a fall or collision with another player, an overuse injury occurs gradually over time. In many cases, overuse injuries develop when an athlete's movement is repetitive, often during a single period of play, and within these periods of play, games or practices are so frequent that the body does not have enough time to rest and heal. The ulnar collateral ligament is the most commonly injured ligament in throwers. Injuries of the UCL can range from minor damage and inflammation to complete tear of the ligament. Athletes will have pain on the inside of the elbow and frequently notice decreased throwing velocity. Although throwing injuries in the elbow are most commonly occurring in pitchers, they can also be seen in any other athlete who participates in repetitive overhand throwing. An elbow dislocation occurs when the bones of the forearm, like the radius and the ulna, move out of place compared with the bone of the arm, or the humerus. Specific serious injuries that can accompany elbow dislocation include breaking the bones or fractures, injuries to the arteries of the arm or the vessels carrying blood to the hand, and injuries to the nerves that run along the elbow area, impairing movement and feeling in the arm and the hand. The cause of most elbow dislocations is usually a fall, most commonly with the arm extended completely. However, any traumatic injury, such as a car crash or a fall during skiing, can result in an elbow dislocation. Nursemaid's elbow is a particular type of elbow dislocation that most commonly occurs in young children who have had an abrupt yanking of their forearm. This results in a dislocation of the head of the radius at the elbow. It is common in children less than 5 years old. Elbow dislocation signs and symptoms. Severe pain in the elbow, swelling, and inability to bend the arm are all signs and symptoms of an elbow dislocation. In some cases, people may lose feeling in their hand or lose a pulse. Arteries and nerves run past the elbow, so it is possible that a person may have injured them during the dislocation. Consequently, a nerve injury may result in abnormal sensation or an inability of normal distal arm or hand functions below the elbow. Children with nursemaid's elbow will not bend their elbow because of pain and may hold their arm slightly bent. An elbow dislocation is a serious injury that needs medical care. At home, put ice on the elbow. This will help with the pain and reduce some of the swelling, but the most important thing is to see a doctor immediately. The terrible triad of the elbow is a traumatic injury pattern of the elbow that is characterized by an elbow dislocation, a radial head fracture, and a coronoid process fracture. The mechanism is commonly as a result of a fall from an extended arm that results in a combination of valgus, axial, and posterior lateral rotary forces which produce a posterior lateral dislocation of the structures of the elbow. They fail from lateral to medial, and the anterior bundle of the medial collateral ligament is the last to fail. In most cases, the lateral collateral ligament is disrupted. Signs and symptoms: patients will complain of pain, clicking, and locking with elbow extension. Upon physical examination, we might find obvious deformity or varus instability. They may also show signs of valgus instability from injury to the medial collateral ligament. Elbow dislocations are very complex injuries that are difficult to treat. The injury may result in chronic instability of the elbow. Following a typical elbow surgery, the elbow is immobilized at 60 degrees of flexion for 6 weeks. Additional rehab can include hand exercises, cardiovascular endurance, isometric exercises, range of motion exercises, and isotonic exercises. A Volkmann's ischemic contracture is a permanent flexion contracture of the hand and wrist, resulting in a claw-like deformity of the hand and fingers. Passive extension of the fingers is restricted and painful. Volkmann's ischemic contracture is the direct result of an undiagnosed compartment syndrome. It is excruciatingly painful and disabling. Any fracture in the elbow region or upper arm may lead to Volkmann's ischemic contracture, but it's commonly caused due to a supracondylar fracture of the humerus. Volkmann's ischemic contracture results from an acute ischemia or necrosis of the muscle fibers of the flexor group of the muscles of the forearm, especially the flexor digitorum profundus and the flexor pollicis longus, which become fibrotic and short. This is caused by an obstruction in the brachial artery near the elbow, possibly from improper use of a tourniquet, improper use of a plaster cast, or a compartment syndrome. This is also caused by a fracture of the forearm bones, which cause profuse bleeding from major blood vessels of the forearm. Unfortunately, the damage to the structure is irreversible, so the patient will be forced to live with this contracture for the rest of their life. Epicondylitis occurs as a result of inflammation at the medial or lateral epicondyle of the elbow. The medial and lateral epicondyles serve as major muscle attachment sites. Repetitive contraction of these muscles can cause constant irritation of the epicondyle, resulting in epicondylitis. The common flexor tendon originates off of the medial epicondyle and commonly results in medial epicondylitis. Medial epicondylitis is commonly known as golfer's elbow. This does not mean that only golfers have this condition, but the golf swing is a common cause of medial epicondylitis. Many other repetitive activities can also lead to golfer's elbow. Throwing, chopping wood with an axe, running a chainsaw, or using many types of hand tools can contribute to medial epicondylitis. Any activities that stress the same forearm muscles can cause the symptoms of golfer's elbow. Overuse of the muscles and tendons of the forearm and elbow are the most common reason people develop golfer's elbow. Repeating the same types of activities over and over again can put too much strain on the elbow tendons. These activities are not necessarily high-level sports competition. Shoveling, gardening, and hammering nails can all cause pain of the golfer's elbow. Swimmers who try to pick up speed by powering their arms through the water can also strain the flexor tendon at the elbow. The main symptom of golfer's elbow is tenderness, pain at the medial epicondyle of the elbow. Pain usually starts at the medial epicondyle and may spread down to the forearms. Bending your wrist into a flexed state, twisting your forearm, or grasping objects can make the pain worse. You may feel less strength when grasping items or squeezing your hand into a fist. Treatment for medial epicondylitis includes price, NSAIDs, stretching, and possibly the use of an elbow strap, which will change the line of pull of the tendon and thus can help reduce pain. Tennis elbow occurs at the lateral side of the elbow and is more common than medial epicondylitis. Tennis elbow is a type of tendinitis or swelling of the tendons that causes pain in the elbow and arm. These tendons are bands of tough tissue that connect the muscles of your lower arm to the bone. Despite its name, you can still get tennis elbow even if you've never been near a tennis court. Instead, any repetitive gripping activity, especially if they use the thumb and first two fingers, may contribute to tennis elbow. Tennis elbow is the most common reason that people see their doctors for elbow pain. It can pop up in people of any age, but is most commonly seen in people around the age of 40. Tennis elbow usually develops over a period of time. Repetitive motions, like gripping a racket during a swing, can strain the muscles and put too much stress on the tendons. That constant tugging can eventually cause microscopic tears in the tissue. Tennis elbow might result from tennis, racquetball, squash, fencing, weightlifting. It can also affect people with jobs or hobbies that require repetitive forearm movements and gripping such as carpentry, typing, painting, raking, and knitting. The symptoms of tennis elbow include pain and tenderness on the bony knob or outside of your elbow. This knob is where the injured tendons connect to the bone. The pain may also radiate into the upper or lower arm. Although the damage is in the elbow, you're likely to hurt when doing things with your hands. Treatment of lateral epicondylitis includes price, NSAIDs, stretching, and the use of an elbow strap, which again changes the line of pull of the tendon and thus can help reduce pain.